Top 9 science-backed fruits for diabetics. Lower blood sugar fast. What if I told you there are delicious fruits you can enjoy without worrying about spiking your blood sugar? Fruits that not only taste amazing but can also help protect you from severe diabetes complications like heart disease, nerve damage, and vision problems? Today, I'm sharing the top 9 fruits to eat for diabetics, backed by science, and how they can transform your health. Stick around, because this information could be a game changer for you. By the end of this video, you'll know exactly which fruits to add to your diet to stabilize your blood sugar, reduce your risk of complications, and feel your best every day. Plus, I'll explain how these fruits can help with specific diabetes-related issues like neuropathy, retinopathy, and cardiovascular problems. We'll start by understanding what the glycemic index, GI, is and why it's so important for diabetics. Then, I'll walk you through a list of the top fruits for diabetics, explaining how each one impacts your blood sugar and overall health. I'll also cover some precautions you need to know, especially if you have other conditions like kidney disease. So, let's get started. Before we dive into the fruits, let's talk about the glycemic index, or GI. The GI is a scale that measures how quickly a food raises your blood sugar levels. Foods with a low GI, 55 or less, are digested slowly, causing a gradual rise in blood sugar, while high GI foods can cause spikes. For diabetics, choosing low GI fruits is crucial for maintaining stable blood sugar levels and avoiding complications. Now, let's look at the top 9 fruits for diabetics, starting with number 1. First up, number 1. Berries. Berries are packed with antioxidants and have a low GI. For example, strawberries have a GI of 41, blackberries are at 25, and raspberries are at 32. A 2022 systematic review and meta-analysis published in Nutrients found that increased berry intake improves key risk factors for metabolic syndrome and reduces the risk of cardiovascular disease. This study, conducted by researchers from the University of Eastern Finland, also showed that berries can lower postprandial glucose levels within 15 to 30 minutes after consumption. Berries are also rich in anthocyanins, which reduce inflammation and oxidative stress, helping to prevent complications like neuropathy and retinopathy. So, add a handful of berries to your breakfast or snack for a delicious and diabetic-friendly boost. Next, number 2. Citrus fruits like grapefruits and oranges. Grapefruits have a GI of 25, and oranges are at 43. These fruits are high in vitamin C and flavonoids, which help fight inflammation. Their fiber content also slows down glucose absorption, so you'll typically see their effects on blood sugar within 30 to 60 minutes. A 2020 study conducted in Kerala, India, and published in the Journal of Diabetes Research showed that incorporating low GI fruits like citrus into South Indian cuisine reduced cardiovascular risk factors in type 2 diabetes patients. The flavonoids in citrus, such as hesperidin, also improve blood vessel function, reducing the risk of cardiovascular disease and protecting against nerve damage. Number 3. Apples. You've heard the saying, an apple a day keeps the doctor away, and for diabetics, this couldn't be more true. With a GI of 36, apples are rich in fiber and antioxidants, which help stabilize blood sugar levels within 30 to 60 minutes after eating. A 2022 randomized controlled trial called the Magikarp study, conducted across Italy, Sweden, and the United States, demonstrated that low GI fruits like apples and a Mediterranean-style diet improved glycemic variability in adults at risk for type 2 diabetes. Apples also contain quercetin, an antioxidant that reduces inflammation and helps prevent damage to the retina and nerves. Just remember to eat the skin, it's where most of the fiber is. Now, here's a surprise, number 4. Avocados. With a GI of less than 15, avocados are one of the best fruits for diabetics. They're high in healthy fats and fiber, which means they have almost no impact on blood sugar levels. Plus, they're great for heart health, something every diabetic should prioritize. A 2019 meta-analysis published in the American Journal of Clinical Nutrition found that low GI diets, including fruits like avocados, reduced BMI and total cholesterol in diabetic patients. The healthy fats in avocados also reduce inflammation, which is crucial for preventing neuropathy and cardiovascular issues. Add some avocado to your salad or smoothie for a creamy, blood sugar-friendly treat. Number 5. Dragon fruit. It might not be as common, but it's a fantastic option for diabetics. With a GI of just 29.54, it's rich in antioxidants and fiber. A study published in the Journal of Pharmacy and Bioallied Sciences showed that dragon fruit pudding resulted in an average decrease of 69.40 milligrams per deciliter in blood sugar levels in type 2 diabetes patients. Dragon fruit's high antioxidant content also helps protect against oxidative stress, which can damage nerves and blood vessels over time. If you haven't tried dragon fruit yet, now's the time. Number 6. Cherries. Cherries are another excellent choice for diabetics, with a GI of 20 to 25. They're high in antioxidants, which can help reduce inflammation and protect against complications like neuropathy and retinopathy. A study conducted by researchers at Michigan State University found that cherries contain anthocyanins, which have been shown to improve insulin sensitivity. These compounds also help reduce inflammation, which is key to preventing nerve damage and cardiovascular issues. Just stick to fresh cherries rather than canned ones, which often have added sugar. Number 7. Pomegranates. Pomegranates are a bit of a superfood for diabetics. While their exact GI isn't specified, they're generally considered low GI and are packed with antioxidants. A 2019 systematic review and meta-analysis published in the American Journal of Clinical Nutrition found that low GI diets, which can include pomegranates, were effective at reducing HbA1c and fasting glucose in people with diabetes. Pomegranates are also rich in punicalagins, antioxidants that protect blood vessels and reduce inflammation, lowering the risk of heart disease and nerve damage. Number 8. Dates. Dates are a bit higher on the GI scale, but they're still a good option in moderation. They're rich in minerals like potassium and magnesium, which are important for overall health. A study published in the Journal of Agricultural and Food Chemistry found that dates have a low glycemic load when consumed in small portions, making them a suitable snack for diabetics. Dates also contain magnesium, which helps regulate blood pressure and supports nerve function. Just be mindful of portion sizes, as they are calorie-dense. Lastly, in number 9, we have kiwi. The kiwi fruit has a GI of 53, making it a moderate GI option. It's rich in vitamin C and fiber, which can help with digestion and blood sugar control. A study published in Advances in Food and Nutrition Research highlighted that kiwi's unique combination of fiber and antioxidants can support metabolic health. The vitamin C in kiwi also helps reduce inflammation and improve blood vessel health, which is essential for preventing cardiovascular complications. A small serving of kiwi can be a refreshing addition to your diet. While these fruits are great for diabetics, there are a few things to keep in mind. If you have kidney disease, you may need to limit high potassium fruits like bananas and oranges. Also, remember that whole fruits are always better than juices or blends, as the fiber helps slow down glucose absorption. And as always, consult your healthcare provider before making any major changes to your diet. So, there you have it, the best fruits for diabetics to eat, backed by science. From berries and citrus fruits to avocados and dragon fruit, these low GI options can help you stabilize your blood sugar, protect your heart, and reduce your risk of complications. Remember, diabetes itself doesn't directly cause death, but its complications, like cardiovascular disease, kidney failure, and severe infections, can be life-threatening. That's why managing your diet is so important. If you found this video helpful, please give it a thumbs up and share it with someone who might benefit. Don't forget to subscribe and hit the bell icon so you never miss a video that could improve your health. And if you've tried any of these fruits or have tips to share, let me know in the comments below. Your experiences could help others in our community. Speaking of helpful videos, here's one on the screen for you to watch next. Just hit play.